Effect of filters. In electromyography, we use a bandpass filter to attenuate noise, interference and artifacts. The filter is characterized by two frequencies, low and high. Signal frequency content below the low frequency setting are significantly attenuated. By suppressing the low frequencies, the signal baseline becomes more stable. Since higher frequencies are unaffected, it is also called the high-pass filter. In a similar way, the signals above the high frequency setting are also attenuated. This reduces the high frequency noise and gives a smoother appearance to the baseline and to the potentials. Lower frequency signals are unaffected. Hence, this is also called the low-pass filter. Filters also affect the shape of the potentials. The top trace shows a single muscle fiber action potential recorded with a low frequency setting of 3 Hz and a high frequency setting of 10 kHz. The waveform appears biphasic. When the low frequency is increased to 500 Hz, the negative peak is shortened and the waveform appears triphasic. The amplitude is unaffected. With further increase in low frequency to 2000 Hz, the amplitude is decreased. When the high frequency setting is reduced from 10,000 Hz to 5000 Hz, the amplitude decreases. The rising edge is less sharp and has a longer rise time. A more rounded peak is seen at 3000 Hz setting. In single fiber EMG, the low frequency setting is 500 Hz. This attenuates the activity from potentials from distant fibers that contain mainly low frequency signals. Thus, filtering increases the selectivity of the electrode. The negative peak becomes shorter and gives a better separation between two action potentials. The amplitude is well preserved to get a good signal-to-noise ratio. Let's look at these changes to a single muscle fiber action potential. The high frequency setting is 10 kHz and the low frequency is set to 3 Hz. The signals are shown at 200 microseconds per division. These signals are recorded with a single fiber electrode. The waveform is biphasic. Note the duration of the negative peak. Increasing the low frequency setting to 500 Hz, now the signal becomes triphasic and the amplitude is changed in the terminal phase. The negative peak duration is reduced. By changing the low frequency setting to 2 kHz, the waveform becomes triphasic and the amplitude is reduced. Back to 500 Hz and then to 3 Hz. Now we change the high frequency setting to 5 kHz and the rise time becomes longer and the amplitude is decreased. At 3 kHz the peak is rounded, the sound is dull and the rise time is even longer. Back to 5 kHz and then to 10 kHz setting. The recommended setting for single fiber is 10 kHz for the high frequency and 500 Hz for the low frequency. When a concentric needle electrode is used for jitter studies, we recommend a low frequency setting of 1000 Hz. This should increase the selectivity of the electrode. Further increase, for example, to 2000 Hz may significantly reduce the amplitude of the potentials and therefore give a poor signal-to-noise ratio.